Hi, it's me, AJ. How's everyone doing? Let's see. Hello. I'll give it a minute for everybody to settle in. Hello. Hi, everyone. It's me, AJ, and welcome to yet another live. I know it's getting more regular. Well, what I have in mind is to bring on experts and experienced voices so they can teach us one or two things to help us make more informed decisions and also hopefully to learn something to help us be better versions of ourselves, really. So it's not just going to be skincare related. Now, I know quite a bit about skincare, but mostly because I read a lot. I learn a lot. I learn like I'm going to write exams with it, no joke. But it really helps when you get to hear things from people who have more background and experience in the sciences. Like this special guest who's coming on here. He's got a background in toxicology, in pharmacy and pharmaceutical chemistry, medical lab diagnosis. He's got it all. So when I picked the topic of toxic skincare ingredients, the no-no list, the dirty list, etc., he was the one I had in mind. So let's welcome on Mo from Mo Skin Lab. Show him some love in the comments, please. Oh, yes.
Hi
Hi,
AJ, how are
Mo.
you?
Hi, Mo. Welcome.
Thank you so much for having me.
Thank you. Thank you
Can you
for
hear me
coming.
well or no?
Oh, I can hear you. I can hear you clearly. Everybody you can hear. CP. Everyone you
I,
can
w-
hear.
I will just use my headphone just to make sure there is no echo or anything. Just
Oh,
one
okay.
second. Um,
Hi, everyone. For those who just joined, there's Mo from Mo Skin Lab. He's here with us. Mo, I'm very excited about today. So I'm just going to try and tone down so I don't get overexcited.
Don't worry, I'm excited and nervous. I think that is my second life here.
Oh,
So, yeah,
don't be, please. Please. How has your day been? What's it?
it was okay. Recently, I started my graduation internship, so it's been hectic, to be honest. And yeah, it was a long day, to be honest, and very, let's say it could have been better. Just like, let's leave it out there.
I'm hoping this makes it better for you. I really
Yeah,
appreciate the time that you're making. Really,
thank you.
I
No
really
worries
appreciate
at
it.
all. It's a pleasure, to be honest.
I'm happy. So we're gonna start with some rapid fire questions. So
Yes, let's do it.
it's not all related to skincare. It's just going to get progressively harder and harder. But I need you to answer as quickly as possible.
I will try with my average English. So,
Okay. Oh yeah, see, you're empty. It's not average. Anyway,
no, thank
so
you.
we're starting mountain house or beach house.
Beach house,
Okay. Next one is, would you put cereal in before milk or milk before cereal?
cereal, then milk.
Hmm. Okay. Most overrated skincare ingredient.
I would say hyaluronic acid.
Okay. Um, Another one would be, let me quickly make this. What track would we play to get more on his feet?
Uh,
What music?
that's that's a hard question because mostly listen to remixes of different songs together. So, like a little bit of Beyonce, a little bit of Nicki
Ooh,
Minaj remixed together.
hey!
Done.
I know some by the counter is going to be excited to hear this
Yeah.
Beyonce heavy.
Yeah. We both know.
Yeah. So now the most difficult part, I'm just going to paint a scenario.
Yeah.
It's spring 2023. You've come to the UK to visit some friends.
Yeah.
Sephora is having a physical launch, so their stores, they're opening up their stores.
Yeah.
Hopefully, they're going to open in the Midlands this time,
Okay.
but that's just my projection. Um, Amex calls you. Amex, American Express. They say, "Mo, we've been watching your stuff. You're really great, and
Okay.
as you're in the UK, we're giving you a black card. Load up your basket. We want to see your routine. Just it's all on Amex. What's in your basket?
Okay. It will be mostly, I will use ingredients to be honest.
Okay.
As retinoids first. Second would be ceramides. Third would be salicylic acid and glycolic acid. And lastly would be something with Centella asiatica. And I would be so happy. Sunscreen is a must. I will not include it, but those are my top 5
Okay.
ingredients. So
that's your ingredients. If I'm looking in your basket physically, what would I see there?
okay, for retinoids, I would say the Sunday Riley's one, the high dose vitamin A, and would be Aven retinal products. They are top notch. For the salicylic acid, for a cleanser, I use very basic, like the CeraVe one. I love this product, the SA cleanser. For the glycolic acid, I would use the Burrito Refreshing Toner, which is also an amazing one. For the Cica, I would use the La Roche-Posay one.
Okay.
Top notch. Best of the
Cica Plus Bomb.
best, yeah, the best, especially with the new formula. I don't know if you tried it. Amazing.
I've not tried that yet.
Yeah, and what else? We said salicylic acid, glycolic acid. Ceramide would be the Dr. Jart line for ceramides. Amazing.
Okay. I see where you're going with this.
Yeah.
So from what I'm seeing here, you're either a maximalist or you like free things like me. So that's what I'm seeing here.
Yeah. I'm not of like the fancy stuff guy. I don't know why. Like I've tried a few fancy stuff. Some of them were sent to me by like brands. Some of them were sent like as a gift from friends. But I like them, but I wouldn't spend that much on them, to be honest. So
okay. I just spend on what my skin loves. So if it loves a cheap one, I mean, products work. There are great products within budget, and there are great products.
exactly.
So whatever feels nice on my skin is what I go for normally. But
that is a golden.
What?
That is a golden tip, to be honest.
Yeah.
Like, what works for you?
That is it. Another thing I wanted to point out is, so when you mentioned the things in your basket, I didn't see any gender neutral products or for men products. But as a lot of people know, skincare is for only women. I know this is killing me coming out of my mouth. So I'm just going to let you take the proper stance and then tell them what's going on.
Yeah, it's actually like where I came from, it is way worse when it comes to how things are marketed, especially skincare. Sunscreen even is heavily marketed towards women, even in instruction how to use a product. It is targeted towards women. Like in my language, there is a female, male kind of language. So it's directed to women on how to use it. And here it's way less severe, let's say, but it's still in a way, you don't see men, for example, on an ad for sunscreen. It's very rare in a way. You don't see an acne. Recently, it's getting better, but before it was like heavily on women with acne, women with hyperpigmentation, etc. But like a breaking news, men has skins too. So
I know.
I don't know why it's heavily focused on that, and hopefully things in the near future will change. That's what I'm hoping for.
I'm really, really glad you touched on that as well. Men have skin too. Skincare is for everyone with skin. This is something I say a lot, but I still have debates with some of my friends about how routines and things like that are for women. And I mean, That's another story for another day. But
Yeah,
I'm glad
we
you're
should do
open
live
to it.
about that.
Yes, we should. And yes, it helps that brands understand that the narrative that they're putting out there is not making it any easier. That's why you have new brands
Exactly.
popping up like Little Men from Brad and another one saying they have genderless skincare when skincare in general is genderless. Um,
Exactly.
Another thing too that people tend to talk about is they don't really want to use skincare because a lot of the products and things absorb into the bloodstream.
Yeah,
And they do talk about penetration. Well, you know about penetration versus absorption. But as
exactly.
someone who has the background and more experience with this, how much of it can you tell someone that actually gets absorbed into the bloodstream?
So it's a very, very complicated topic. I tried to cover it with a series of posts called The Skin, the Great Barrier. It's like a two-part post. And our skin is an amazing, amazing organ at keeping stuff out and keeping good things in. Like there is my main study and experience is in pharmacy and pharmaceutical science, and there a whole branch in pharmacy studies and pharmacy science to just understand how we can deliver a drug through the skin. It's a very, very hard challenge. And I don't know if you notice, like in the pharmacy, the amount of treatment that is delivered through the skin is very limited, like creams for skin infection, maybe dandruff, psoriasis, and that's it. You don't see a heart drug or a heart disease drug delivered through the skin because it's super, super hard. And to set a limit or a percentage is also impossible because it depends on the compounds itself. It depends on the formula. For example, some compounds, let's say for salicylic acid, let's take it as an example. Salicylic acid with the right formula can penetrate the skin with a big amount. It can sometimes reach to 60% of the applied dose. And for a different compound, let's say a big molecule like polyhydroxy acid, it won't penetrate your skin at all as an ingredient. So it also depends on the, like what we call it, physiochemical properties of the ingredient itself, how big it is it a charge, is it a non-charge, is it water loving, is it oil loving? All of those are a huge factor in defining, is it going to penetrate or not? So setting this 60% and saying, okay, our skin is a sponge and it absorbs 60% is like saying, very generalized, like all people can fly or all people can ride cars, or it's very generalized, like no, not all people can drive a plane or fly a plane. So it's very generalized. So I can't give you a percentage, but I can tell you it depends. And I know people hate this answer, but unfortunately that's it.
That's what it is. But I like what you're doing because you're talking about penetration, not
Yeah.
absorption.
Yeah,
Now, people,
yeah, because people are mostly scared of penetration, reaching the blood, reaching the internal system and the circulating system. So that is what scares the people the most.
Okay. So that's when we're talking about these things, you mentioned chemicals, and I know people really fear the word chemicals. I know water is a chemical. There's so many things by definition which are chemicals, but people generally fear the word chemicals and acids to talk about it. And it doesn't really help that new definitions and things are popping up for natural skincare
Exactly.
and what they call clean and everything. It doesn't really help that conversation because people tend to feel like natural is better than chemicals. But what can you add to that conversation for anybody who's out there scared of chemicals?
To be honest, we can look at it as everything surrounding us is a chemical. As simple as that. The water, the air, the food, the supplement, the drugs, everything, us are a bunch of chemicals combined in a very certain and sophisticated way. So to be afraid of something, to be afraid of everything is impossible. It can induce a lot of stress. Is this good for me? Is this bad for me? Is this going to give me an XYZ disease? Is this going to be safer, etc.? So the whole narrative about using fear and using the lack of knowledge when it comes to marketing and telling this product is better because it's free from X, Y, and Z is, I think, is very sinister in a way, because it preys on the fear of people and tell them, okay, use this one and don't use our competitors because they are going to try to kill you or poison you with a specific ingredients. So I can say is that to lessen the fear that you have, everything around you is a chemical compound. Sometimes it's a mixture of ingredients, sometimes it's a single ingredient. So don't worry. When you take a breath, which we all do all the time, you are inhaling hundreds of gases, which are chemicals. You don't think about that, but you think about a cream you apply on the skin. So just try to simplify it in a way, and don't be afraid of the word chemical, because we are all chemicals.
I like how you're saying it, but you think you're trying to lessen people's fear by saying that chemicals are all around them. But I'm just picturing someone going, chemicals are everywhere.
Exactly.
You know?
I'm sorry if I frightened you guys more, but it's a reality. We have to get a reality check before we can make any judgment.
Yeah, and I feel like some of this also leads people to go for DIY skincare.
Yeah.
Thinking that that is better than using skincare products because those are chemicals. But as you said, chemicals are everywhere and they're everything. So what can you let them understand? Because I remember some time back, Lori Harvey mentioned that she uses yogurt for her skin. And well, some people also took it out of it that, well, it's the lactic acid inside. But why go for the yogurt, which is natural, but you might not get what you need out of it, rather than go for something that is specially formulated to deal with your problems, you know? So people who use DIY skincare, what can you tell them about the efficacy of what they're using and all of those things?
People tell me a lot of times in my DMs that I am too honest. Sometimes people tell me I'm rude when it comes to the safety of cosmetics. Mm-hmm. I accept that with an open heart, because I back home when I worked in a community pharmacy, I've seen the result of those kind of things. Like literally people have their lives destroyed because of DIY that contain vinegar, lemon, and honey, etc. It has a higher risk to give you a bad result than a good result. So DIY ingredients are not, like, I'm not going to say they are the worst in the world, no, but you can do way much better, save money, get result with a product that you can pick up in the nearest pharmacy or drugstore, because those products are created by specialists that knows what is going to happen when you apply it on the skin. They know the percentage. You mentioned the yogurt example. It's correct. It has lactic acid, but how much lactic acid? We don't know. How much time do I have to leave it on? We don't know. Also, it has a live probiotic, which is a live bacteria. For a person who may be immune compromised and has a cut on his skin, that can be a problem. So people sometimes, okay, it's a yogurt, I can eat it, so I can put it on your skin. You can eat a lot of things that are not good for you, but you shouldn't apply it on your skin. So get your lactic acid serum. It's more effective. You're going to save money and enjoy that yogurt with fruits or whatever you want. You will see more benefit in that way.
Ingestion. Yep, you're right. Another thing that scares people about using these chemical stuff is the fact that they say that they cause cancer and they're endocrine disruptors. So basically they are interrupting the normal way of the hormones in the body functioning. So whether it's reproductive or with the brain or immune system, whatever it is, people tend to get scared that there are carcinogens in all of these things. So you find that things like chemical sunscreens, because of the chemical components and the chemical filters inside, oxybenzone has been villainized. Several filters have been villainized because of that, because they say they cause cancer.
Okay.
How can you explain those things to someone? Like,
Okay. So I hope I don't scare more people with this, but I'll try my best. So every day, daily life, you are exposed to, I would say, hundreds of compounds through air pollution, through food contamination. That has the probability, or what we call it, a carcinogenic compounds. But your body has an amazing defense mechanism of repairing that damage and preventing cancer from developing. So to get a cancer, there are a lot of studies that say you need more than between 10 and 20 mutation, like 10 or 20 damage done on your DNA for the cell to become a cancer cell. So just saying a compound that has been found in your blood, let's take oxybenzone, for example, a very demonized ingredient. It is a UV filter. It protects you from, let's say, a thing that we are sure about that is going to cause you cancer, which is the UV rays. It is absorbed into the blood with concentration that is higher than we thought before. Okay, what's the issue with that? We've been using oxybenzone for more than 30 years. No related cases between using it and cancer incidents. There are literally zero. And when we move to the endocrine disruptors, we need to understand endocrine disruptors in a way as a lock and a key. The key are the chemical, the lock is the receptor in our body. So those compounds have the tendencies or the intrinsic properties to just connect with that lock and maybe or maybe not have an effect. But there is something in pharmacology, we called it affinity, like how much this key is drawn towards this lock, let's say. Those affinity when it comes to, let's say, parabens, oxybenzone, and those UV filter, older UV filter, they have a very, very low affinity, which means if, for God forbid, this compound got into our body, it's connected with that specific lock, the natural hormone on our body have a higher affinity, like they are drawn more. What happens is that the hormone literally can remove that compounds from the receptors and just use the process, normal process continue to happen. This is one of the things that people need to understand, that it's not just, water has the ability to freeze, but that does not mean every water and at every condition is going to be an ice or evaporate, becomes vapor. So it depends on the dosage, how much amount of that compound needs to be present in your blood to equal a normal hormone, the strength of a normal hormone. So this is just we understand it. The amount were in nanograms, they are very small amounts, and the affinity is always in the side of normal hormones. So to have to say that those ingredients are going to be like causing endocrine disruptors, in a way it's correct. They have this ability to integrate with this lock, but at what conditions, when this is going to really happen? That's the issue.
Okay, so from what I'm understanding, it's not just about even the toxicity being in the dosage, but also the affinity. So like you're saying, even though water can be in solid form in ice, it does not mean water is always in ice form. So the same way, if we have these chemicals in our cosmetics, the dosage inside, everything has a tendency to do something in the excessive doses. But from what I've understood from your page and your lessons, I call them,
Yeah, thank you.
it's yeah, it's is that skincare ingredients are scrutinized a lot before they're allowed to go on the market. So the doses that are in each of these products are not enough to harm you if you are supposed to, even in terms of sunscreens like the homosalate and the oxybenzone and everything inside, it's not in the dosage that would cause cancer or cause or disrupt your endocrine system. Basically, that's what you're
Ex-
explaining.
Exactly. Let's simplify it more. Let's say I gave you, AJ, a cup of water and put you in a desert and told you, make it an ice. It's this without any help, without anything. You cannot.
Yeah.
That is the same. Like we are using sunscreen UV filters at a certain concentration. It's literally almost impossible. Let's say I'm just trying to be conservative here. Almost impossible to do any impact or damage or adverse effects with regular usage. So that's as simple as I can go, because literally you cannot turn water to ice in a desert. So,
Okay, see, this is one of the reasons why I follow your page. You make things really simple for everybody to
thank you.
understand without making us look stupid. Because I have a lot of stupid questions, I call them, because I don't
No,
know about things. And the
there is
only
no
thing that,
stupid question. Like, trust me, in college and during my bachelor, I asked those questions hundreds of times. One time, a quick story, I almost got kicked out because I was asking too much. So feel free.
I've been there. Okay, I used to
Exactly.
ask a
So
lot of questions, and I always say that that's why I know as much as I do, because I ask a lot of questions. I'm curious. I want to learn more. And I believe that communicators like you are very, very useful for the layperson to understand. Now, it's not just brands marketing things out there that, okay, you can use this and it does this, that, that. You are taking the skincare science and letting us know that, okay, this is doing this, that, that because of these particular ingredients and because of the way it's formulated. And really
exactly.
appreciate that. I
Thank
feel
you so
like,
much.
yeah, I really appreciate that. I feel like it's some of this information that needs to get out there, because an ingredient like aluminum salt has become demonized recently as well. Because I hear people going for natural deodorant, which, yeah, some people still are left stinky after that, but they feel it's safer to do that. What is the issue with aluminum salts?
So aluminum salts are, I don't know where they, like, if you Google aluminum salt and you go to the image part of Google search, you will see that this kind of sketch applying aluminum salt, and it absorbed into your lymphatic system, then to the breast, causing breast cancer. I don't know where sketch came from, but the issue with aluminum salts is that it can cause a lot of irritation for a lot of people. It's not something that we say, okay, it's not. No, it is. It's happened and it will continue to happen. But when it comes to safety, penetration, and how much deep it absorbed into the skin, it's very limited. The main work of those aluminum salt is, in a way, forming a plug on your pores that slows and not completely 100% stop your perspiration, but it's, in a way, it slows it down, make it less intense. People think, oh, okay, if it goes through the pores, then it goes through much deeper and it will cause problem. A lot of studies, like, literally went the extra mile to prove, okay, aluminum salts, how deep are they going into the skin? And they found it's like the dermis, they didn't find any evidence of the aluminum salts. So we are talking about the epidermis and the pores itself, nothing deeper than that. Animal study can be different because the skin of a mouse or a rat is different than our skin. And one study, for example, that tested on human skin, they did is apply this compound and they leave it for a certain amount of time. Then they use like a special tape to remove each layer of the skin, and they analyze how much aluminum salts are in there. Like by reaching the deeper skin layers of the skin of the epidermis, they almost found that it's undetectable. There is not a lot of aluminum salt. So people shouldn't be afraid of aluminum salt. They are safe, effective. They are approved in all the regulatory market that I know of. And they can save you a lot of, let's say, embarrassment, at least.
Yes. So I like how you mentioned as well about irritation with this one. So people are thinking it's out there doing the most, but as you've explained, it doesn't even penetrate beyond the epidermis, even to the lowest part of the epidermis. But in terms of irritation, everything has the possibility to irritate someone out there. And
Exactly.
to find people saying something like alcohol, no alcohol in my skincare, no fragrance in my skincare. But I feel like they all have a purpose, and you would know that better than I do. Can you?
Yeah. Like this is also the thing that was viral, in a way, viral topic, let's say, few months ago, saying that, okay, my skin care product is not fully made of the active ingredient that I need. It has filler, let's say, ingredients. What those, we call them in the pharmaceutical science, we call them excipients, and they have an amazing purpose in every kind of product. For example, people said that our product, one company that contacted me through email, that I want to mention that because it was so funny. They said, okay, we love your content. We want to send you our waterless product. So it's very concentrated. It has all the active ingredients, and it does not have any filler ingredients. And when I looked at the ingredient list, the main solvent, let's say, of which was, as I remember, like called colloidal silver. It's colloidal and silver. Yes, it basically, the main compound on that is water. So I don't know why are they trying to do that, but every ingredient in your skin has a purpose, unless you don't like fragrance, let's say, or have an issue with fragrance. Fragrance are just for the sensory type, or how the experience of the product, the colorant as well, if you are into that. So other than that, all of those, the preservative, the emulsifier, the surfactant, penetration enhancer, active ingredients, all of those in the formula to serve you a purpose. Other than that, there is no filler ingredient.
Thank you. I like that you also mentioned the surfactants, because another thing that has gone under fire recently, well, not recently, for as long as I can remember with the clean beauty movement, is SLS and SLES being a major problem. At one point, I worked with one of the MLMs, and the key selling point was no parabens, no SLS. And people were made to feel like that is so wrong in skincare. So when someone is buying shampoos, someone is buying anything that they feel they need to look out for, they'll just check to see no parabens, no SLS. What really is the purpose of these ingredients in the skincare, and why do you think it's villainized so much?
Okay, so let's start with parabens. They are, I think, the most villainized group of ingredients in all the cosmetic industry and in, the cosmetic community. And they are because of one study that found, it was like, even the author of the study said, I didn't mean that. Why are you saying this about my study? So the study just took a sample from a cancer patient with breast cancer, and they found parabens inside of the cancer tissue. And then a storm started since then, that parabens will cause you cancer, give you cancer, it will give you, ruin your endocrine system, etc., etc. And parabens have been used for more than 100 years. So if that is going to happen, or a side effect that is going to emerge, we will notice that, definitely. I want to mention something, and I really, really hope everyone watching this go check out this story. It's called the thalidomide scandal. It is about a drug that was developed in Germany in the 50s, and it was considered the miracle drug. It was used for nausea, cold, flu, and epilepsy. It was used for everything. Like, the marketing company went out. It was an OTC drug. And unfortunately, a lot of companies in different countries were like racing to get the license to produce this compound. Eventually, 50 countries started to produce that. And then the company decided to market it toward pregnant women for morning sickness. And there was not a lot of data back then. 60 years ago, the regulation were just very loose, let's say, compared to today's regulation. Unfortunately, during like less than 7 years, 10,000 baby unfortunately was born with deformities, like missing a hand, missing a leg, and neurological issues. And in 6 years, we noticed that there is something wrong is going on. And immediately in 6 years, we found out, unfortunately, there were casualties, which is those 10,000 babies. But we know that this is going to happen. Imagine things used over 100 years, like parabens. We noticed nothing. Exactly, zero correlation between an endocrine. They have the ability to do so. They have the ability to interact with the receptor, the lock, but at a certain concentration that it needs to be 100,000 times more than used in the product. Mm-hmm. So you can imagine the number that is like, I need the concentration to be 100,000 times more, which is like the whole product. You are using just methylparaben as a cream. Mm-hmm. So that's the issue. If there is something wrong, or if there is a company trying, let's say, to poison us, trust me, we will notice. The public will notice. Everyone will notice there is something is going on. And during those old days, 60 years ago, in 6 years, we found that. Imagine now with the current regulation, current pharmacovigilance, which is just monitoring after the drug or cosmetic has been released into the market. Is there any report of side effect, adverse effect? So we will find out in a week and completely remove it from the market.
I like that, because, sometimes they bring out announcements that certain ingredients are being pulled out. And it is interesting for me to find out some of them, because sometimes it's not that it's causing issues for people, but that's why you find that in some countries it's still allowed to run, in some countries it's not. I think EU has very strict regulations compared to America and some other places that I am aware of. Yeah, sorry.
No. I was going to say also, this is the like a very kind of a viral statement that, okay, EU is very strict. It's just not as strict. It's a different way of work, let's say. In general, when we look at EU versus the US, and when we talk about EU, I also include the UK, because they have a very similar kind of system until recently, but it's still the same. They try to tell cosmetic company, like, you have to do A, B, C, D, like very specific, very primitive, let's say, way. This is no. This second ingredient, no. The third ingredient, no. In the US, they depends on the common sense. Okay, you shouldn't put jet fuel in your cosmetics, because that would be considered a big problem, and you will be fined, and a lot of problem will happen after that. So it's just a different way of working, let's say, different way of regulation, but at its core, it provides a very similar safety approaches. In the EU, unfortunately, or fortunately, depending on how you are going to look at it, There are recently the Green Deal, the goal that to make Europe carbon neutral by 2050, and that will affect how regulation is going to affect chemicals, especially cosmetic, personal care, drugs, etc. And things will be, let's say, in the very near future, going to be very strict compared to the US, because they are going with approaches that not everyone in the, let's say, the toxicology field or the safety assessment field is very happy about, especially cosmetic companies. The number of chemicals allowed will be so limited after a few years. So let's see how things will fold out. And then we can say it's definitely stricter, but let's hope things goes very smoothly.
Hopefully it doesn't cause more fear around certain chemicals. That's not what we want.
Amazing point. That is actually one of the main fears, to be honest. Okay, we banned this, but it was used before. It was deemed safe, but why now are you banning it? Because the way of regulating, the way of treating data is going to be different after this Green Deal. It's not because the chemical had changed.
Yes, yes. I'd like you to mention the name of the scandal again for those who missed it.
Okay, the thalidomide, let's see if I can type it.
If you can type it, that would be awesome. Let me get more juice. Hello, everyone. If you joined us in the middle, I'm with Mo of Mo Skin Lab, and we're discussing toxic skincare ingredients, the dirty list, the no-no list, all of them. We're trying to take that stigma away from certain chemicals from a factual point of view. And I've seen some questions go through as we're going on, but it's very helpful if you put it in the question box, which is, you can see the live and then the person, and then there's a comment with a question mark inside. If you can put it there, it's easier for me to track it than to pull up the questions as we're going. But it's been a very interesting conversation so far. And Mo is sharing with us a scandal that, have you put it there?
Yes. Should I put it in the Q&A or they can't see it?
You can put it in the question part so that I pin it as a comment.
I put it, I think. Should I put it again or you didn't see it?
I can't see it here. It'll probably pop up. If you can see it on your end, it's probably slow on my end. So.
Okay, I put it again. I don't know.
Okay, let's see. So another one that I want to ask you about, these just about 3 left that I want to push before we go on. There's the whole thing about coal tar, petrolatum, mineral oils. So I've got seborrheic dermatitis, so coal tar in my shampoo is very useful for me. People also, I've got dry skin. I don't slug much, not because I've not been doing it. Some people like to do that. They don't see a problem with it. Some people see a problem with it. People generally have a problem with petrolatum and skincare. What do you think is the big deal about it?
Okay, so the coal tar, petrolatum, and mineral oil. So let's separate petrolatum and mineral oil in one category and coal tar is another. So coal tar is just a mixture of like almost 10,000 compounds. It's derived from treating a special type of coal with high temperature to extract a very like brownish gooey kind of substance. So the main compounds are just hydrocarbons, which mean compounds are made from carbon and hydrogen in different structures. So, and also the main subpart of the hydrocarbon are phenolic compounds. Those phenolic compounds have the ability to like slow down your cell proliferation rate. So in cases like, let's say, dandruff, dermatitis, psoriasis, thanks to, let's say, an inflammation in the skin, the cells are always messaged to proliferate and divide and create more cells. And this is lead to accumulation of cells on the epidermis and giving you this like rough skin, scaly skin, dandruff, etc. Because the scale between your natural skin exfoliation is tipped by too much skin cells are made. So what TARs do is that slows down that skin proliferation rate to equalize everything, and you will have a very good result with that. The issue with coal tar, let's say the concern that most people have is that it contains a subgroup of compounds called polycyclic aromatic hydrocarbon. Those are a subgroup of compounds that are known to be carcinogen. They have the ability to bind to your DNA and cause problem with that DNA. And actually, it's one of the hypothesized mechanism that how coal tar work is that it slows down your cell ability to create DNA for the new cells. This is one of those mechanisms that are thought to be how coal tar works. But animal studies showed that long treatment with coal tar on the whole body of a rat or a mice for a long period of time, a chronic study, showed that it induces a non-melanoma skin cancer in some of the samples. But when those studies are repeated on a human, because it's a very old, let's say, ingredients, very useful, but very old in a way. They found that short treatments, the way that we use it with shampoo, like for 3 to 5 minutes and rinse it out, there were literally 0 cases of cancers. So in a way, and the ability, because like I said, it's made of hydrocarbon. Usually hydrocarbon, specifically in coal tar, the groups are mainly very big with very big side chain of hydrocarbon. So penetration is not going to be so deep. It treats the epidermis cells. So in short, animal study, we have cancer. Human study, short treatment that we use as indicated has 0 evidence. It is still approved in the US. It has, I think, 3 preparations that is approved in the US for treatment of dandruff, psoriasis, etc. And it's deemed safe in the US. In the EU, it is still acceptable by the EMA, the European Medicinal Agency, as a drug, but in cosmetics, it is banned. So you can't get it unless you have a prescription with the drug. Yeah, that's it. And people think, okay, it is banned, so it means it's bad. No, because it might have a higher risk than other ingredients. But with the usage of this product that contains coal tar, as intended, the risk is almost 0. So there is nothing to be like afraid from coal tar.
Okay, so let me, in summary, generally the skin, if you have a condition like seborrheic dermatitis, the skin overproduces some cells, and that's why you have the excessive flakiness. With an ingredient like coal tar in, it slows down that production so that it's more or less controlled. Now, it's been tested on animals, and people need to understand that animal testing is not the same as human testing.
Exactly.
Tony Capricornium has this excellent post on that.
Exactly.
We're not a rat, basically.
You are not a rat.
Yes.
Exactly.
And with that, you can understand that that test showed the risk. But then from what you're saying, when it was tested on human beings, because it's short contact, it didn't show any signs.
Exactly.
But that is why it's also regulated by going through prescriptions so that people don't have access to it freely. Not that the chemical itself is bad, but it needs stricter regulation to ensure people are more protected. That's what I've got from what you said.
100%.
Okay. So based on that as well, someone would try to understand that things like tretinoin and hydroquinone, which are also very, very useful ingredients, are not available on the market, over the counter, not because they're bad ingredients, but
Yep.
because they need stricter regulation. Because some people are really scared of hydroquinone because people have used it in the worst possible ways, like mixing it with mercury in products and causing skin
Exactly.
bleaching and all of those things. So people are generally very scared of an ingredient like hydroquinone, which, from what I've learned, is the gold standard of hyperpigmentation treatment.
Exactly. It's the top, to be honest. You brought an excellent point, to be honest. People need to understand one thing is that cosmetics and drugs are regulated differently. Cosmetics are used by larger number of people. The risk benefit scale does not exist in cosmetics. We don't, because cosmetics are not essential. It's not a must to use. So we don't need any kind of risk that is accompanied by a cosmetic product. What I mean by risk, a big risk like systemic toxicity, cancer, etc. Those kind of big side effect, adverse effect. So cosmetics needs to be super safe to be allowed to be sold as cosmetic because they will be available to literally everyone can use them. Everyone can go to a supermarket and grab a shampoo, grab let's say a retinol product, etc. Drugs, on the other way, there are risk benefits. Little more risk are accepted when we are regulating drugs because drugs in a way are essential. We want to treat a disease that is, let's say, very harmful to a human being. So we will accept a certain more space of adverse effect. That's why, for example, in 2020, the FDA removed the hydroquinone from being OTC. It was available in the US as OTC at 2%, and it moved it to prescription. So the 2 and 4% are now prescription in the US. Before it was OTC for the 2%. And they saw, like you said, they saw a lot of people using it in a bad way, not very, let's say, not following the indicated use, the way of the correct usage of this. And because it is a drug, in a way, it has a lot of, like I said, a little bit more of risk. And this risk, when used by a big number of people, it will show. So let's say 1 million people used OTC 2% hydroquinone. The rare side effect that we accepted to treat hyperpigmentation will show because big number are using it. Yeah. So and even some people don't use hydroquinone, they are using it because it's available, because it's so good. So that's the issue.
Yeah. I think that breaks it down for quite a lot of ingredients as well. So I personally think it's good that a lot of these are going under prescription than being readily available, because people are just going to blanket statements and throw them out there that this ingredient is harmful, when really and truly everything has the potential to be harmful.
Exactly 100%. Because why, sorry, I don't know why it's this happened by the FDA when they removed the 2%. But I think the rise of like skincare community, social media, and saying hydroquinone is the best, is the gold standard for treating hyperpigmentation. People were so hopeful. People were like going after hydroquinone, using it, like saying more is better. It's OTC, it's available, so it literally has zero risk. So I think that's why when an increase of usage, there will be an increase of risk. In a way, and the FDA then decided like 2 years ago to, okay, it's going back to prescription.
Yeah, that's why we can't have nice things. We have to spoil it every time.
Exactly.
Well, the last one I want to mention before we can check out, just for everybody who's still on, the question box is, I've just got one question in the question box. There are lots of questions in the whole feed, but it's better if you put it in the question box so I can easily access those questions. The last one that I want to mention is preservatives. So one of my favorite, not favorites per se, but when my first child was younger, he had a flare-up of eczema. And the product that I found really worked for him was Dream Cream from Lush. And the selling point on it is preservative-free. But here I am, someone who really does not mind preservatives because preservatives are essential for skincare to last. That's what I understand about it. But people have villainized something as essential as preservatives. From your standpoint, how can you let people understand that preservatives really aren't the demon that they've made them to be?
Okay, I can start this by saying every human is very unique when it comes to the composition of their DNA map, their genome material. People are very different. Although we are all humans, people are different how they react with chemicals. So people, like you said, the case with your child reacting badly to preservative, it's a valid...
No, sorry. I didn't say my child reacted to preservatives.
But the only product that worked well was preservative-free, let's say.
No, yeah, that was the product that worked well. But I didn't go after it because it was preservative-free. It just happened to be preservative-free. I would have bought it.
You haven't tried any other product with preservative or no?
I had tried other products, but it just happened that this one that worked for him had preservative-free written on it. I would have bought it if it had preservatives. So I don't understand why the selling point of it was preservative-free.
Okay. So what I meant is like people reacting to preservative in a negative way is valid. Actually, one of the biggest companies when it comes to cosmetics, Aven, has a product that is preservative-free. They created a product that is preservative-free in a special kind of packaging that is airtight, so they don't have to use a preservative. And they sell it towards, it's I think it's quite expensive, more expensive than other products, but it's packaged in a special way so to eliminate the need of usage of preservative. And it's manufactured in a different way than other cosmetics. So everything has to be sterile, the production line, everything, and so we don't need preservative in the product. So the fear of people reacting badly towards preservative is a valid point. It's actually very true. There are cases where people are not tolerated towards paraffin, phenoxyethanol, or any kind of other kind of preservative. But those numbers are compared to the general public are very limited and very low. That doesn't mean we have to exclude those people and say, no, you have to use those preservative. No, we have options. Big companies are doing that for a certain reason. But the way other company using preservative-free, not just like, okay, I want to target those vulnerable small groups. No, I just want all people comes towards me because preservative are bad. In a way, in general, as a blank statement. Mm-hmm. So if you react badly to preservative, you are valid. It's true. You are not imagining things because there are literally people that are allergic to water. It's a very known medical condition, but that doesn't mean water is bad.
I'm sorry. I've heard that before, but yeah. I'm just wondering, how do they bath? How do they drink water? Like,
it's one of these documentaries that I've seen of this. Actually, it was a girl from the UK that has this very rare disease where she has to take baths. Sometimes, it's like every time she touches or every time the humidity in the room raises above a certain level, the water in the air, it can affect her skin and start blistering out, and it's like a nightmare kind of situation. She bathes with alcohol, or sometimes they use propylene glycol type of a product that just to wipe off any type of dead skin cells, etc. And it's a mess. When it comes to how they drink water, in some specific cases of this disease, internally, they don't react, just on their skin, outside exposure, which is like a weird kind of medical situation, but it's there. people are allergic to water, but that doesn't mean water is going to be bad for everyone.
See, we learn something new every day. And I told you there are stupid questions, but
No.
yeah, I had never heard it and I wanted to know. So now I know. See, I know we've taken a lot more time than I proposed, but
No worries. I'm free. So if you are free, I'm free.
thank you. So I'm just going to go ahead and read the questions in the question box real quick.
Yeah.
And then we'll conclude it so that people who have other things can rush off to do them. So if you're joining us, if you're just joining us, we've been talking about toxic skincare ingredients, the dirty list, the no-no list, etc. And it's been a very entertaining and educational conversation. Now, one question here is from Jessam Lee, and it says, I've heard about people in some regions soaking in crude oil for healing skin issues. What do you think about this? It obviously works for some people, maybe because it's crude oil and it's not treated like petrolatum and other hydrocarbon infused products. To be honest, this is the first time I'm hearing this.
Okay, so I'm not gonna act like I'm surprised. You hear a lot of different kind of traditional old, let's say, usage or all the kind of advice passed by your great grandparents to next generation of using a specific like weird ingredient to treat. So crude oil is, like I said, is a mix of ingredients. It contains about 10,000 to 100,000 kind of compounds, different compounds. Most of them are hydrocarbons. Some of them are phenolic. Some of them are polycyclic aromatic hydrocarbon. Those actually have a biological effect on the skin. For healing the skin, I don't know what specific case, but let's say it's eczema, psoriasis, for example. It will work. Is it safe? No, but it will work in a way. Those compounds can, like I said, slow down your cell's ability to multiply. And in a way, also some kind of phenolic compounds in the crude oil have the chemolytic ability to break down the bonds between the cells. So you will see result, but is it safe? I would say 99% no, because the concentration of those polycyclic hydrocarbon are going to be not well controlled, not well known, and those are known carcinogen. That's the issue. I'm not surprised if it's going to heal your skin. I think it will, but the safety is going to be very, very, let's say, risky.
Questionable. Okay, so just Lee, I hope that answers you. Soyboy222, that's the last question we're reading. It says, I consider buying Uriash essence and with Albizia julibrissenbach extract. Is it any worth? I hope I've not butchered it, but
actually I don't know about this product or this actual extract, to be honest, but I will look it up, and if I found something, I will post it on my story.
Okay, that's very good. Thank you so much. I have one last question for you.
Of course.
And what would be your message to your younger self? Because I know you mentioned that you started the skincare journey when because you had acne, basically.
Yeah.
I also went down the same path. But if you had any message, not just in terms of skincare or anything, what message would you give your younger self?
So that's a deep question, let's say. And I would give it as a general advice is that dreams actually comes true, but they need a lot of work. Life is not always as a fairy tale. Sometimes life is unfair. And it takes sometimes things will come your way when the time is correct. That is the best advice I can give my younger self and everyone listening. Just be patient.
I think that is also directed to me. So thank you. Thank you.
Of course, my pleasure.
I've really enjoyed this conversation.
Same.
I've enjoyed learning so much, and hopefully another time we'll be able to have you on here.
Definitely. Just I'm a DM away. So
thank you.
Of course.
Thank you. And if you're not following Mo already, like I said, he makes things really easy to understand. And I go there to get very, very basic breakdowns of things that seem so complicated. So give Mo a follow
Thank you
and
so
catch
much.
you some other time.
Of course.
Take
Thank you
care.
so much, and have an amazing day.
You
Or
too.
evening, let's say.
Yeah. Have a great week.
Thank you so much. Thank
Okay.
you.
Bye.
Bye.
Thank you for joining,
Bye.
everybody.
Bye. Thank you, everyone. Bye.